see about the resisted exercises. So resisted exercises are the exercises which can be done actively by the patient with the help of a resistance. So resisted exercises can be given in two forms. One is manual resistance and second one is mechanical resistance. Manual resistance can be done by the patient or with the help of the therapist, and mechanical resistance can be given by external devices such as pulleys, therabands, weight cuffs, sandbags, dumbbells, etc. So now we will see about the resistance exercises given for each and every joint through the model. So now we'll see the resistance exercises for cervical joint. Cervical flexion. This is done using the theraband. Neutral. Cervical extension. Cervical side flexion. This is done for the right side. This can be done in the left side also. Cervical rotation. This is for the right side. This can be done for the left side also. About the resistance exercises given for the shoulder joint. So for this we have used the dumbbells, that is 2 kg weights. Shoulder flexion. Neutral. Shoulder extension. Neutral. Shoulder abduction. Shoulder adduction. Shoulder internal rotation. Neutral. Shoulder external rotation. Neutral. Now we will see the resistance exercises for the elbow joint. Elbow flexion. Elbow extension. So now we will see the resistance exercises for the radio-ulnar joint. Pronation. Neutral. Supination. Neutral. Resistance exercises given for the wrist joint. Wrist flexion. Neutral. Wrist extension. Neutral. Wrist radial deviation. Neutral. Wrist ulnar deviation. Neutral. So now we will see the resistance exercises for the fingers and thumb. So first is finger flexion. Neutral. Finger extension. Neutral. Finger abduction and finger adduction. So now we will see the exercises which are given to improve the grip strength of fingers. First is, this is to improve the whole grip strength. Finger pinch exercises. Next, to improve the grip strength in the proximal and distal interphalangeal joints, this exercise is known as finger hook exercise. Now we'll see about the resistance given for the thumb flexion, neutral. for thumb abduction and adduction. This exercise is known as finger scissors. This is used to improve the strength of the finger abductors. So now we'll see about the various resistance exercises given for the hip joint. Hip flexion, neutral, hip abduction, neutral, hip extension, neutral. So we'll see about the resistance exercises for the knee joint. Knee flexion, knee extension. So now we'll see the resistance given for the knee extension in the sitting position. Neutral. Hip internal rotation, neutral, external rotation, neutral. Ankle inversion, neutral. Ankle eversion, neutral. Now we'll see about the resistance exercises given for the toes. Toe flexion, neutral. Toe extension, neutral. Toe abduction and adduction,